Welcome to the series, Minerals for Whole Health, short lessons on the vitamins that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about magnesium. Magnesium is a chemical element found, like all others, on the periodic table. Its symbol is Mg, a combination of two letters in the word. Magnesium is the fourth most common element in the planet Earth after iron, oxygen, and silicon. It's also the third most abundant element dissolved in seawater after sodium and chlorine, from which of course we get sea salt. Magnesium is required for many functions in the body. Let's go through a few. Many in the series of chemical reactions that convert fats and carbohydrates in our diet into energy require magnesium to happen. The synthesis of DNA, RNA, and certain proteins, including enzymes and antioxidants, require magnesium. Magnesium is necessary as a component in the structures of the bone and teeth matrix, cell membranes, and even your chromosomes. Moving ions like potassium and calcium across cell membranes, a very important process, especially in nerve cells governing muscle contraction and heart rhythm, requires magnesium. Magnesium is required to form the cell signaling molecule cyclic AMP, which is vastly important as a molecule used all throughout your body to regulate biological processes. Lastly, magnesium is involved when cells migrate from one location to another, as in the case of a wound that is healing. With this kind of pervasive use in the body, you can see why getting adequate magnesium is important. Magnesium deficiency is thought to be rare, as many foods contain it. However, there is an emerging consensus that the soils of industrialized nations have become lower in magnesium over time due to intensive farming practices. It is also true that food processing tends to strip magnesium out of foods, further reducing its presence in the diet. The body has measures in place to preserve magnesium, but on a long enough timeline, with a low magnesium diet, a deficiency can result. A minor deficiency typically simply produces a generic malaise, characterized by fatigue, lack of appetite, and potentially nausea and vomiting. As the deficiency progresses, if not corrected, this can worsen to include skin numbness or tingling, muscle cramps, seizures, and an abnormal heart rate. Now, we've already discussed how low soil concentration of magnesium is a risk factor for deficiency, but what about other risk factors? Alcohol abuse can induce magnesium deficiency in several ways at once. In the first place, alcohol consumption usually stands in for other foods, meaning magnesium consumption goes down. In the second place, alcohol abuse affects the ability of the intestines to absorb nutrients, including magnesium. Finally, alcohol abuse causes the body to urinate out more magnesium than it otherwise would. All told, that's bad for magnesium stores in the body. Old age is a risk factor for similar reasons. In that intake of magnesium through food goes down, absorptive capacity in the intestines goes down, and medications often prescribed to the elderly tend to flush out magnesium through the urine. Conditions that affect the ability of the intestines to absorb magnesium, of course, are in and of themselves something that elevates risk for deficiency. These include inflammatory pathologies like Crohn's, ulcerative colitis, or celiac disease. It also includes bowel surgeries and even bariatric procedures. Lastly, uncontrolled type 2 diabetes causes excessive urination, resulting in greater loss of magnesium and elevated risk of deficiency. So, how much magnesium do you need? The recommended dietary allowance of magnesium for men is 400 to 420 milligrams per day. For women, the RDA is 310 to 320 milligrams per day, except when pregnant, at which point the need is 350 to 360 milligrams per day. Good sources of magnesium include nuts and seeds, leafy greens like spinach, Swiss chard, things of this nature, white potatoes with the skin, brown rice, oatmeal, beef, poultry, dark chocolate, and dairy. The tolerable upper intake level for magnesium has been set at 350 micrograms per day from supplemental sources, but there is no upper limit for food sources, strictly speaking. Over-supplementing can cause diarrhea, nausea, and stomach cramps, but in extreme cases, too much supplemental magnesium can result in a life-threatening drop in blood pressure. If you supplement with magnesium, be sure to recognize these recommended limits and talk to your doctor if you have concerns. Thank you for viewing the magnesium installment of Minerals for Whole Health. We'll see you around.